but I want to get on to what some of the working conditions were for these women. In 1923, when, let's see, we'll get up to, well, what I wanted to show with these is, first of all, you have women, Miss Vera saying doctor, and that's another thing. They always refer to her as Miss Vera Singh. They never refer to her as doctor. The men are always referred to as doctor. And I thought back to when I first came to Cincinnati, people would all call me Miss Ramusack. They never called me doctor or professor, so that you somehow weren't professional enough. Anyway, she's sitting there, and so you're seeing how small the group is, that they're all wearing white or light-colored saris to be more professional. And so you have the scheme growing as the centers are expanding. However, let's see. Oh, and then here's the Child Welfare Center in Georgetown. There was a great deal of debate about that the centers were on the fringes of the slum area and they weren't in the center. And the people who were making the decision about where to locate them, I'm sure that cost was a factor, but they also said they wanted someplace that would be respectable for the women who were working in the center. In 1923, let's see if we have 23. Those are health visitors. I'll go back to this, 1922. In 1922, Vera Singh described the working conditions as the staff of the Child Welfare Scheme does not work within the four walls of hospital, where supervision is easily carried out, where patients and friends, inquirers and well-wishers are all subject to a certain amount of discipline and necessary regulation. I should say that in India, frequently, until quite late in the beginning of the 20th century, when patients went to a hospital, their family would come to cook food for them and give them food so that they wouldn't eat food that, you know, had not been prepared by a lower caste. The difficulty of a nurse in a house full of ignorant, questioning, interfering men and women ready to welcome and accept the opinion of every passerby on the road in preference to that of the nurse may be therefore well imagined. In one instance, a nurse had to wait in a house fully 4 hours to remove a patient to hospital, simply because after the woman had been put into a cart, a Brahmin on the road sneezed. This being considered an ill omen, she was brought back into her miserable room till a more auspicious hour for removal arrived. Vera Singh recalled that initially it was difficult to get the midwives either to carry out orders or to do their work in a systematic manner. And she said, if I had to issue an order to a midwife, I had to frequently cycle to her residence to give it. So you had to be, I guess, a good cyclist as well as a doctor. From the beginning, people did recognize that this was just one factor. And they constantly said that we have to realize that besides care for child welfare, we have to consider milk, a good milk supply, the need for a good water supply, the need for good sanitation, the need for good conservancy, which is picking up the filth off the street. And so there was always this discussion of what was going to give you the most bang for your buck, if you will. The health scheme would point out that the high mortality rate had declined in areas by 1920 served by the Child Welfare Scheme. The mortality rate was 231.2 among live births in areas where child welfare schemes were conducted, while the overall rate for Madras was 280 for 1920. So that they did feel that they were making some headway. However, there were many problems as far as pay was very low and things that we don't even think about. At one point, Dr. Miss Vera Singh is bemoaning that the rickshaw allowance of rupees 15 usually covered only half of the transportation costs for the midwives as they went to houses to assist in delivery. She also made an impassioned quote, appeal to the public for a more respectful treatment of nurses and a greater regard for their profession, if only with the object of attracting respectable women into the nursing profession. And one of the problems these women faced, the midwives would have to stay in these centers, so then they could go out in the middle of the night or whenever they were called for someone who had booked a case. So what are people going to think if a woman is going out in the middle of the night by herself into a slum area? She has no male protector, so she must be on the lookout for either pay for sex or something else. So the midwives would complain that we want a peon, a lower level employee, to accompany us in the rickshaw. Let's see if we, there are some rickshaws right there, but we can't see them too well, and I know time is passing. These are health visitors I won't get to talk about, the staff, you can see. Okay, the women had to go in one of these rickshaws that a man pulled. And first of all, they didn't get enough to pay for their jobs. Secondly, they're going out alone at night with the rickshaw driver. And so then there is the problem that they are frequently harassed by other men. There's also the issue, in 1925, Miss Vera Singh is saying, we need to have sheds to keep the rickshaws, because the women go out in the middle of the night in the monsoon rain, they get wet, they get sick, we have no substitute midwives, and so we are, you know, we aren't able to give the services, and people complain that we're not going out and we're not sending people to do it. And so this is one of the things that would get me upset. I think, why can't these men see that these women need? And then the men, some of the men are also very critical, because these women are living in a house, they don't have a male guardian of their sexuality. And so there are allegations about some of these women are sexually promiscuous. They never come out and say that, but that's the undercurrent of it. So that these women who are trying to be professional, some of whom, you know, probably are not working to full capacity, but at the same time, they have all sorts of strictures on them. In terms of the quality of the training and the work, they are constantly saying, give us more money if you want, give us more respectability if you want, respect us if you want respectable women. By this they mean educated women, higher social class, if not higher caste women, to work in these. But still you have counselors. There was this one who's a doctor, B.C. Malia, says that he said that the corporation midwives actually increased the cost of childbirth for the husband, who had, I quote, still to lodge and feed the barber midwife, that is the dye, and in addition to her fees, find something more for the comfort and conveyance of the corporation midwife. And he said if women went to the Royal Purim maternity hospital run by the corporation, they would have an abundant supply of clean linen, plenty of nourishing food, and would be lodged for a period of 10 or 15 days. The husband pays only the cart hire to and from the hospital, but saves even feeding charges of his wife, the barber woman, and the fees. This is entirely unrealistic, because the corporation had only 2 or 3 maternity hospitals for the whole city. So why do I think there was this attack on these midwives?